Hello everyone, welcome to GrowMed. Welcome back to the Super 30 series, and today is the day 12th of discussing the most important topics which you must know for the upcoming Fmge as well as the Neetpg exam. So this is a series where we are discussing all the frequently asked topics and the questions asked in the exam. Okay, so today's topic is the Croup, an important topic that comes in the pediatric as well as the ENT, and the another name of this one is the acute laryngotracheal bronchitis. So the name itself says that it is something associated with the infection involving the bronchus, means the respiratory tract, then trachea and larynx, and it is acute in condition. Okay, so if you break down the terms here, only you are knowing what exactly the disease means. Okay, so this group frequently questions are asked mostly like the clinical case based question. They can give a pediatric child of some 2 months, 3 months, or sometimes some 5 years, 6 years, and then they will describe the features of this bronchitis, like cough and barking cough and all, and then they can ask you for the diagnosis or they can ask you for the treatment. Okay, so we'll discuss all the things and which type of questions are asked as well. Okay, so it is also known as acute laryngotracheal bronchitis. It is an infection of the airway, and the most commonly affected part is the subglottis. Okay, this is the most commonly affected, then seen most commonly in 3 months to 3 years. So note it down that these can be given in the clinical case. A 2 to 3 year old child and coming with the symptoms like biphasic stridor, respiratory distress, then low grade fever, barking cough and all. So these are the features which will be presented by the child, and the a causative organism for this one is the para-influenza virus. PYQ asked multiple times. Okay, so the question can be given like they can give the clinical features and they will only give the diagnosis as the Croup. They will be describing like the diagnosis of Croup is made. Which of the following can be the causative organism? Okay, so para-influenza virus is the causative organism of PYQ. Then the investigation of choice for this one is the X-ray, and on X-ray you can see a sign, a very important sign, and if at all you might have solved the PYQs or read about this topic, then you might have an idea of this X-ray. This is called as a steeple sign, the sign which you can see on the church. तो जो church columns पे sign दिखता है, that one is called as a steeple sign, and you can see here infection of the larynx and the trachea giving this sign. Famous image asked multiple times in the Neetpg as well as the Fmge, and this image, like, you should be sure whenever this kind of image is given, you should be sure about the diagnosis and all the other things related to the question. Okay, then treatment is mostly symptomatic. Okay, so for almost all the patients we will be providing symptomatic treatment, like we will be giving the humidified O2, bronchodilator and steroids. A PYQ, this was also asked, like what is the management for the Croup. So all the three things will be described in the clinical case, and you need to choose it. And steroids we will be giving when the case is very severe, like most severe, and if it is not being resolved by the humidified O2 and bronchodilator, then only we'll be giving steroids. Otherwise most of the time just humidified O2 is enough for this one. Okay, so it is not a bacterial infection, it is a viral infection. Do remember this one, because sometimes it is very confusing. Most of the things are caused by bacteria, right? So we tend to think that most of them are caused by bacteria. So this is a viral infection, and antibiotics are not given in case of this one. Okay, so just remember this one. This is very important point, because it is there in our mind, right? Whenever we think of any infections, like we tend to give antibiotics. So antibiotics do not work for viral infection. Antibiotics bacterial drugs mostly work for the bacteria. So this is one important thing which you must remember. So that's all in this video. I hope this video will be helpful to you and you will like it, and if you're new to GrowMed, subscribe to GrowMed. For the PDF, you can join my Telegram channel. The link is given in the description box. And for flashcards and some important reels, important topics and all, you can follow me on the Instagram. The link is given in the description box. I am Dr. Padmini, your mentor for the Fmge. Thank you so much, guys. Like the video, share the video, and subscribe to GrowMed. Once again, thank you so much, and all the best for the exam.